Hello, it's Tuesday, October 13th, and I'm Gary Pace, the Lake County Public Health Officer, doing today's coronavirus update. We currently have 638 total cases in the county, 47 active, and now with a total of 14 deaths. The latest resident to pass away was not a part of a nursing home outbreak, was over 65 years old, was in the hospital at the time of death, and had chronic medical conditions. We continue to remain in the red tier, and our current case rate is 8.8 per 100,000, and positivity rate is 3.8%. If the case rate stays high, we could potentially have to move into the purple tier, which is the most restrictive in the next few weeks. Also, we're tracking the case rates in the communities that have been hit the hardest with COVID. This data will be made public within the next week or so. And as in other parts of California, the Latino community and the Native American communities have higher case rates than would be expected by their percentage of total population. This is called a health disparity or a health equity issue because there are some underlying problems that lead to this higher burden of disease. These folks have less access to medical care and other services. They've had to contend with some discrimination and fear of the government, and often are essential workers that end up being in the public even when they would rather work remotely or be off of work due to symptoms. There's clearly no innate genetic or other problem leading to the higher rates in these communities. The problem is in the delivery of services and access to resources. The state is now pushing local health departments to take a closer look at these disparities and direct more resources towards these communities that have suffered with higher caseloads. We have been working on this improved response in Lake County and will provide more details in the near future. We did experience a surge in cases a few weeks back that peaked a month ago at 78 cases in 1 week and has recently come down to our more typical levels of 30 to 40 a week. Recently, we began seeing the numbers climb upwards again. This is partly due to a second senior residential facility outbreak that has resulted in 30 cases and 1 death in this second facility. The first one is now doing much better, and the situation is completely stabilized. The staff at this second facility are working hard to contain the outbreak as well. In addition to the nursing home outbreak, there is continued community transmission. Around the state and the country, we're beginning to see the increase of cases that was predicted for the fall, and this so-called second wave may be in its early stages now. Most experts are predicting that we will see an increase in cases this fall as people move indoors more, which leads to more transmission of the virus. Please get your flu vaccine to help prevent this potential complicating factor. In addition, we are anticipating the COVID vaccine becoming ready sometime after the first of the year in limited supply and potentially ready for widespread use by late spring or summer. That would mean that after a difficult winter, we may be able to get back to some degree of normalcy by late summer or fall of 2021. So I want to talk a little bit about gatherings and Halloween coming up. The state has come out with some new guidance on social gatherings. They recognize that people are sorely missing contact with family and friends, and that it really wasn't working to not allow any social gathering for such a long period of time. The new guidelines say that people can gather outdoors with masks on except for short periods when they're eating or drinking, and with enough space for social distancing. The idea is to have people not mix between families a lot, so up to 3 households can gather at one time, but no more than 3 households. They recommend that you connect with the same group of families over time to minimize the risk, and no absolute cap on the number of people is given. The specific guidelines are on the CDPH website. Halloween is almost here, and the state is coming out today again with guidance on how to enjoy this holiday safely. The main idea is that trick-or-treating is discouraged. Safe Halloween activities can be planned that minimize contact and mixing of people from different households. In our community, many such activities are being planned, so we encourage taking your kids to these safer options this year. Facial coverings that cover the mouth and nose are still required and maybe can be incorporated into the costume. There are similar guidelines from the state that will be coming out today about El Dia de los Muertos for people that celebrate that day as a way to honor their deceased friends and family. Hopefully by next year, we can enjoy our holidays in a more typical fashion. Moving forward, we've been dealing with this pandemic now for about 7 months, and the stresses are huge for everyone. Fortunately, since we have been in the red tier for several months, our businesses and schools have had more flexibility than neighboring counties, and a lot of this is due to the hard work that most people have been put into staying safe. The virus is sneaky and will take advantage of any carelessness or laziness around taking precautions, so we encourage everyone to stay vigilant as we move into colder weather where people tend to stay inside more. Almost certainly we will be seeing a rise in cases across the state and the country in coming months. So let's see if we can avoid that here in Lake County. We would love to be able to move to the orange tier where businesses can open their indoor dining and to 50% capacity, and we can feel more flexibility. Getting control of the outbreaks in the nursing facilities is a piece of that. Getting more services to the disadvantaged communities where the virus has hit the hardest is another part. And all of you taking the precautions that have been successful in the past, masking, distancing, disinfecting, will go a long way towards keeping your family and neighbors safe and hopefully getting us to be able to move forward to the orange tier before too long. Thank you very much and take care.